Good afternoon, everyone. This is mostly for those in Nigeria or West Africa region. For every other person joining in from other regions, I greet you. My name is Azuka, Okeke, and I work for the Africa Resource Center for Supply Chain in Nigeria as a regional director. And ARC is, we call it ARC. ARC is an initiative of Bill and Melinda Gates Foundation. It has been set up to serve as an advisor to countries in Africa and to improve their investments and to strengthen their supply chain for public health delivery. This becomes more real for all of us in Africa and even globally as we all face the current pandemic. Just to start, for anyone here who has lost any loved one or has been impacted economically by this pandemic, my heart goes out to you. The real issues we're facing as a global nation, it's such that for one, it's something that is affecting all of us, which is why we do these webinars. I mean, I see memes now, people saying death by webinar, but I think it has also helped to define that the case of we are all facing something and there's something we can all learn across region. So in my capacity as a regional director, I am happy to be delivering this this webinar today, which is looking at COVID-19, the impact on health supply chain in Africa. I would start by saying, if you have any question or comment, please use the chat. You see the chat box section. Just post it there. I will try and attend to them. I will try and attend to them, you know, just 10 minutes before we close. So thank you so much once again for joining the session. This session is also being recorded. So, and I'm sure if you join in a bit late, you may go back and check the recording by ISCEA. They will share it globally, I would assume. So enough about me. We'll go straight into the topic for today. So I don't know if all of you know about ISCEA and the role they play, International Standards Board HealthCare, and this is their advisory board members. And you can also visit their site, www.iscea.org, to learn more about how they are strengthening supply chains through standards and best practices. ARC is happy to collaborate with them. We have been working together with them in Nigeria, building expertise in supply chain, and which is why doing this webinar for me is a delight, and I hope you will enjoy the session. So where are we today? And this is so, I mean, this pandemic to happen in our generation is such that it presents a learning as to how far we have gone with development, but also very critical for us in Africa. It presents an opportunity for us to take responsibility. And this is why I share this slide, which is more like, where were we before the outbreak and what are we doing now? What are we doing differently? And if you look at it, we all passed through the stage of Ebola, where everybody was hoping that Ebola would not really spread, just like we have seen COVID spread. And Africa did something, I would say, commendable during the period of Ebola, to try as much as possible to put in a response system to curb the spread of Ebola. Recently in DRC, they showed that they had seen their last case, and I'm sure even that country is trying to maintain whatever standard that has been put in place to make sure it still doesn't, you know, it's a viral infection, that it doesn't come out again. But it just shows us that there are things that we put in place which are commendable, but were they enough? Were they adequate? Was the adequacy enough for Africa to address the pandemic? And you look at it today, I would like to share what I got from WHO Center and WHO website. As at today, We have 54 of the 55 countries in Africa affected by COVID. As of today, we have 927 cumulative cases of COVID. We have 3,574 reported deaths. We have 48,323 reported. We're not doing so badly, but we have also done some things to try to manage this pandemic. And these are some of the things we learned during the pre-COVID period. And for instance, there was that realization that we cannot handle pandemics as countries, that there was a need to address it as a continent. Why? Because we all know that our borders are pretty much, we are a community. So we pass through our borders seamlessly, whether through trade or whether through community connectedness. You know, you cannot say to somebody in Cameroon not to enter Nigeria simply because there is a pandemic. We will always find a way to go. We will always go across borders to meet ourselves because we are, first of all, a continent. So there was a realization that there was a need to work together as a continent when it has to do with outbreak, and not to just see it as it's my country or it's your country. But also, Ebola taught us that there was a need to improve our commitment as leaders in Africa. Over years, we have seen it. Africa has been so dependent on foreign aid, and we realized the gap in government investment, and there was a call for African leadership. So that need to have a one approach or a strategy that defined our continental approach. We also saw there was little leverage in the private sector. There was a need to see that pandemics or outbreaks was not something that you leave totally in the hand of government. Everybody would be affected in one way or the other. So it needed us to look at this issue of commitment and interest from the private sector. These were some of the learnings that we had during Ebola. And you see that being translated into real action during COVID-19, which is really good to see. You find that the African Union leveraged the technical capacity of the Africa CDC. And you could see that even in individual countries. In Nigeria, you could see the National Center for Disease Control taking real leadership in addressing the pandemic. And I must say there was quick action. There was no need to deliberate at the beginning. There was quick action by NCDC. Communication was coming out regularly, and there were even the lockdowns before the cases started being seen in some countries. So you could immediately see the AU leveraging the Africa CDC to begin to provide the continental response, which was that integrated approach we're all looking forward to. You could also see the commitment, which translated to the $61.5 million pledged by AU members, which is really commendable. You could also see that 54 of the 55 countries, Ministry of Health, jointly came out with their strategy. And of course, we could see the involvement of the private sector in the board for the anti-COVID response board. So that is commendable. We set up immediately an anti-COVID response board. That was quite different from when we had the Ebola. The Ebola taught us a lot of things. The outbreak of Ebola taught us that we needed to work as one, and you already see that that is something that as Africa we did together. So this shows us that yes, we're moving in the right direction. Of course, we looked at it for the COVID response. We see support coming even from external bodies in the area of public health. So, COVID is such that it's not just about the health, the economic impact, the lockdown, even the socio-economic impact is even more glaring when you talk about COVID. You look at the issues around equity. Who are those more affected? How is it affecting everything about them, their general well-being? So definitely, it's good to think about the response holistically, but for this purpose, I'm focusing on public health. And we saw the Jack Ma Foundation and Alibaba Foundation earlier enough donating to the 54 countries affected. And of course, in Nigeria, we've received our first batch. They've released the second batch, and they're committed to another batch. So we saw that there was a foreign aid still coming to strengthen what the continent had put in place. Then, of course, we see even Afrexim Bank making a commitment of 3 billion. I actually had opportunity to talk to one of their representatives who wanted to know how the supply chain ecosystem in Nigeria really fits into the response. So to show that in real terms, they are doing their groundwork in addition to having the finance facility available. I think another thing we see with regards to public health is the emergency operating centers that was instituted by the Africa CDC in every country, the national EOCs, and even within the countries, you see even at regional level, the EOCs taking leadership. That was something that it was necessary to have that proper coordination and integrated approach for us to begin to address the public health need. And the EOC's role is to guide countries, and in this instance for public health, to provide support to the logistic pillar for the country. I had the privilege to work with Lagos State in Nigeria to strengthen their logistic pillar with regards to having an emergency strategy for addressing procurement and supply chain. And you could see how the support from the EOC and the support we provided from the private sector angle could complement what the state had put in place, which makes a compelling case that there needs to be an integrated and coordinated front for everyone to address pandemics. We cannot address it the way we address typical public health systems, because it affects everything literally in the society. So these are the things. There are other support I didn't mention in this slide, coming from the EU, coming from the other agencies. I think I also highlighted them in this next slide. You see Gavi focusing a lot on vaccine, so and preparing for vaccines when they do come. We also see the USAID donating ventilators, and of course Bill and Melinda Gates looking into vaccines, whether through research and all other areas. ARC is a Bill and Melinda Gates initiative, so we provide some form of strategic support, albeit in a small way. The Global Fund, of course, which is so commendable, they have repositioned grants, grants that ideally typically address malaria, TB, family planning, and other areas. Global Fund is saying, well, in countries where they have given support, it may be necessary to reposition the grants to strengthen COVID. All these are things that are strengthening the public health system, in addition to what the countries have put in place. And our question is this adequate? The country being supported by the NCDC, is it adequate? Are countries better prepared? Did the Ebola pandemic, or not pandemic, the Ebola outbreak, did it prepare us well enough to put in structures that made it more adequate for governments to address public health, and coming from the angle of supply chain management? So, you know, in presenting this initial slides is to tell you what has been put in place, what we learned, and what are the supports coming in, what are those supports speaking to. You could see that most of the supports are speaking to logistics, making commodities available. Is that enough to have the adequate supply chain management or even procurement strategy to address the COVID response? So now, what is supply chain management? Because it's very important that everybody is on the same page. Now, if you look at this slide, you will see the logistics, the movement of commodities. Then, of course, you see where you have the procurement, the asset management, the supply chain enterprise, application, product. These are all components. These are all components of the supply chain management. But in this context, I want us to look at supply chain management in a very simple form of how do we make decisions with regards to what commodities come into the countries for COVID? How do we make decisions with regards to how much funding to put into the system for the logistics or for the planning or for the asset management or for the procurement? What are the funding? How do we shape the funding? Who makes that decision? Who makes the decision with regards to the information coming in to guide the countries? Who are making those decisions? Is it enough to, according to the Africa CDC, one of the strategies they have is they have put in place a strategy to establish and manage national and regional stockpile for public health emergency response. So the Africa CDC, in their own strategy, they are looking at emergency preparedness, laboratory systems, public health research, and of course, surveillance and disease intelligence. And under the emergency preparedness, if you go to the key strategies there, which is where we need to see what do they have in place at that regional level for supply chain management. What they have in place there is to establish that let me put it like this, that each country should have to develop and implement a preparedness plan. Each country should have their own plan. Do we have that in Nigeria and other countries? I believe so, with the support of the NCDC, the National Center for Disease Control for Nigeria. There is an emergency plan. Now, that there is also, under emergency, that we have an emergency operating center. Do countries have this? Yes, Nigeria for sure. We have that, and other countries have EOCs. Now also, they said they will establish and manage the national and regional stockpile for public health emergency response. Now, that is where the likes of Jack Ma, Gavi, everyone is trying to chip in. And under the EOC, you could see maybe there will be technical support partners. But is that adequate to say we have a comprehensive supply chain or emergency supply chain plan? Because when you're talking about supply chain, you're talking about the decision making. Who makes the decision for what we stockpile? Who makes the decision for how much we invest in transportation, in planning, in having a clear strategy? Who makes the decision in terms of how we get information, the data management, the information flow? Do we see this in the Africa CDC strategy? Not clear if there is. Is the expectation that the partners supporting government should have that? I think it's something we should have at regional, in addition to having that as part of the plan for each country. And if I go here, you see the challenges we have. And if we have these challenges already within the COVID response, then we know there is a critical need for our regional and also our country strategies to include having a concrete public health supply chain management strategy. For instance, we know that over the years, Africa has been heavily dependent on exports for public health. Heavily. I attended a webinar by Pamela Steele, associate recently, which was quite, I think I learned a lot. I like to attend webinars, pardon me. I learned a lot from that. And one of the things they showed was that our global medicine production in Africa is just 3%. That we are dependent 95 to 99% on importing health commodities. This is a continent where we have almost like 28 million people living with HIV/AIDS, 28 million. And we are not manufacturing our own medicines and even our own equipment. So it becomes critical to know that we cannot keep depending on importation. And this is very glaring when you talk about the lockdowns, where we cannot have effective movement of commodities from China, for instance, or from India, where we're heavily dependent on medicines. So, of course, not having a clear supply chain strategy means that the thinking through on where we get the stockpile, where we source our stockpile, is such that there is a need going forward from what we have learned to put that kind of supply chain strategy in place. The other challenge you see is definitely when you talk about who is making the decision, if we do not have adequate supply chain talent in Africa, then who would make those decisions for us? Who would make those decisions with regards to what to buy, how much to invest, with regards to what to move? Who are making those decisions for us? This is a World Bank Logistics Performance Index. It's old. I would assume a lot of things have changed from when that was published in 2016. But you could see that if you look at the part that shows the availability of skilled supply chain personnel, you will see that if you look at the color code, you see the top quintile, highest performers, and all that. I'll share this slide to ISCEA and you can access it, so I don't spend too much time. But there is a low availability of supply chain expertise in Africa. That's what it demonstrates. There is, it says countries in the bottom 2 quintiles of the logistics performance ranking, including Nigeria, they have low availability of skilled logisticians, especially in the mid-level management role. I think it's even at the leadership role. So the case is, if we don't have supply chain competence in Africa adequate, how then do we begin to, who makes the decisions for us? Are we going to keep importing supply chain expertise to make decisions for us? Will it have adequate context? So these are the challenges we're seeing. And of course, it comes to the point that yes, we've done well. We have put in place a strategy, a regional strategy, or we can say intercontinental strategy, where we are working as one. We are addressing this pandemic as a continent and not just as individuals, because it's the continent strategy, is the regional strategy by ACDC, Africa CDC, sorry, that is defining the national strategies that countries are adopting. It is their guidance that has made it that every country has a plan, that has made it that every country has an emergency operating center. It is their guidance that has made it that we are leveraging even private sector resources, and you see a lot of private sector complementing the efforts that the governments have made. There is improvement in coordination and also commitment. Now you see 54 of the countries signing the pact to work together, to collaborate, and of course you see the amount of money that has been pulled in by countries together to work together in this strategy. Now, with this in place, we now have seen that there is a need for the strengthening for the supply chain angle. Why is that so important? Having worked, I'll just take a step back. Having worked with Lagos State, we had the opportunity to work in Lagos State. One thing critical was, from the onset, the state realized that they required a supply chain strategy, which they didn't get from the EOC. They had been working with the EOC in the state, and they realized that the decision making was not as efficient as they would have required. There was not enough information to make adequate decision in terms of what do we buy, what commodity is lacking, where do we send our stockpile. So because of that process, they came to us and said, oh, we need you to help us come up with an emergency supply chain management strategy. This is commendable, but I think, was that the right time to have an emergency supply chain strategy? We should have had an emergency supply chain strategy. We should have had it in place, and that would have guided the procurement from onset. So that for me is where we are going to. If we have plans, we have government committing funds, it should be guided by a strategy. And for that to happen, why was it something that we could achieve in Lagos? Lagos has a team of supply chain managers working together that have started their certification programs. And thanks to ISCEA, some of them have done their CSCA certification, so they are supply chain analysts, and also some other certifications they've received from ASCM and other bodies, including MIT. So they've started the journey of having their background in supply chain management, so they could readily adopt the strategy. So you see, there are two things here. There is the need for the strategy to be in place, but also the decision makers to be able to implement the strategy to make the right decision. So these are the things we're hoping that even during COVID and post-COVID, that there are opportunities that we can strengthen. And this, you see, we put in here that there's a need to institute emergency procurement and supply chain management strategies in countries. This should be something that the Africa CDC should include in their strategy and not just limit it to having a stockpile. Without that, the decision making will be inefficient. And that, people say, how come Lagos is handling COVID? They are able to communicate effectively. They are able to handle the pressure. Lagos has like 20, we could say even 30 million people in Lagos, and yet you could see that the government seem to know what they're doing, and they seem to be handling the pandemic quite effective. There are areas to improve, but they seem to be doing a good job. We have now been called to help Kano. Is a work in progress, but we feel that this should be what every country should be putting in place. Having a strategy is so important and should be driven by the Africa CDC and also by the government. Then, of course, we believe that the strategy is not just to have, we're talking about emergency preparedness. We should leverage private sector for best practices and expertise. We should know what has ICRC done, what has the World Food Program done, what have they been doing in managing situations of emergency, to learn from that and include that in our strategy. So there is that need to collaborate with private sector to have a more robust strategy in place. The other thing that is so important is we must begin to promote local manufacturing. In Nigeria, for instance, the country put in place, I think, a loan from the central bank and is encouraging the local manufacturers to access this loan. It gives them a single-digit interest rate, which is really commendable. We have been advocating to the country to have a single-digit interest rate loan for industry and infrastructure. So COVID made it possible for us to access this kind of loan. However, if you put in place the right fiscal policy, you have to look at what are the other things that affect manufacturing in Africa. Without power, without the right infrastructure, that whole money is going to go into power. A lot of companies have tried to do local manufacturing in Nigeria, for instance, and it just wasn't profitable because of the need to have the right transport system, to have constant power. So this for me it has to be addressed holistically. For us to go into local manufacturing, the country has to look at all the facets. Where do we need to invest in? I hear countries talk about stimulus, the need to have a stimulus package infused into our economy for our countries to recover from COVID. I think the use of this stimulus package should look at things like local manufacturing critically. What other things will promote local manufacturing? So again, is the leadership in Africa, we believe is commendable. It should now go into the real action of trying to improve the system in a manner that in the end, we would really recover from COVID, both health-wise and economic-wise. Again, the other part that I feel we cannot at any point diminish is to have the right talent. To have the right talent. Without the right talent, even at our leadership level, most importantly, even at our leadership level, if we don't have supply chain expertise guiding countries, telling even at Africa CDC that we need to make this decision based on the information that is coming out of the countries,
we will still be where we are. We could have enough stockpile, but we may not be able to make decisions in terms of how do we send it, where do we send it, how do they move it down to the last mile. So there needs to be supply chain competence, procurement and supply chain competence across level, both from the regional down to the countries, at the national level, down to the regional, down to the state governance level, down to the warehouse level, down to the health facility level. Supply chain expertise has become an urgent need. We need to begin, or even if it's strengthen logistics management expertise, so we make the right decision. So I think for me, that is critical, and I want to commend ISCEA once again, because we have a collaboration with you, and we have been running that too, and you have even given a grant to countries like Nigeria to train 500 experts, at least people, to become supply chain analysts. We want to see more of that, more of such bodies. Support, that should be their COVID support. How do we begin to put in expertise in the countries so that the right decisions are made? So I would pause here. I don't know how many minutes I've used. I hope adequate enough to create room for you to share your questions, if any. So I would pause and see if anybody has any question that we can tackle. That would be good. So you can send in your chat. There is a chat box by your side. And just if you have any question or comments, that would be good.